106.3 FM, The Source.
All right, 25 minutes before 11 o'clock. The morning is flying by. I just ate an apple. How about that?
Nice.
I just ate an apple.
Nice.
I do have some dental issues, though, you know. But fortunately, I can still eat an apple.
Oh, cool.
Dr. Scott Shamblott is on the phone. He is a general dentist. He's also a new product evaluator. So I'm fascinated with that title. He's the founder of Shamblott Family Dentistry, and he's got a book called Fear-Free Dental Care, Finding a Dentist You Can Love. I have the cover of the book on the broadcast that we're doing on the internet, and of course it'll be there when we make it a podcast later on. Dr. Scott Shamblott, good morning, sir. How are you?
Good morning. Thank you for having me.
Where are you? Where are you calling from?
Minneapolis.
All right. How's everything up there?
We seem to be getting a little early spring. It's going to be 40 today. That's a heat wave for us this time of year.
Hey, tomorrow it'll go down to 40 here at 46 at night. So we're looking forward to a cool evening, but it'll be 80-something in the day. So just the difference.
It's all perspective.
Yeah, as Jimmy Buffett said, changes in latitudes or whatever, right?
Absolutely.
Tell me about the new product evaluator part of your title. Is that only dental products or is it all products?
It's only dental products. There's an organization in dentistry called Clinicians Report that is the only unbiased organization. It's kind of like Consumer Reports. So they don't take any money or funding or free products from any dental manufacturer or producer, and they put products through rigorous testing to make sure they live up to their claims. And then once they pass testing, then they're passed to the evaluators around the country to see if they actually, in a clinical situation, do what they're supposed to do.
Are they typically mechanical in nature, or are sometimes they pharmaceutical?
I haven't tried any pharmaceutics. Different dental materials, different dental equipment, like handpiece dental drills, different types of filling material, different materials for crowns, that type of thing.
We as kids, because I'm 63, just so you know, I remember as kids we got the silver fillings, and then later on we found out that was not exactly healthy. So now, is that part of it? You would try something like that?
Trying new materials to replace those materials. Right. That type of thing. Stuff that's already has a track record and things, those we don't get for trial. It's the newer things that have passed all the laboratory testing so that we know they're safe, but do they actually work in the average dentist's hands?
Do we fear the dentist? Is it justifiable that we are afraid? And do children fear it differently than adults?
Two answers. Yes, it's justifiable because a lot of people have had some bad experiences, whether as a first-person experience or vicariously through others, either a friend or a loved one, and sometimes people even pick it up through the media, radio, TV, movies, that type of thing. The dentist is rarely portrayed as a warm, fuzzy, great person in the media. But I mean, it's the way it is. I can't change the media. And in answer to your other question about kids and fear versus adults, it's the perception is very, very different. With kids, it's a little easier to overcome because their fears and their emotions and everything aren't cemented as kind of a permanent part of their emotions and their psyche. It's still easy to be changed and imprinted, so it's easier to help them work through it.
So do any of the products that you test, are they created for that one purpose, which is to alleviate fear? Is there, like, would you give a kid a video game or something to play while you're working on their mouth? I don't know. Anything like that?
No, most of the products are just that I test are for general dental use, that every dentist up and down the street could potentially be using. Distraction does work great for kids, and it works great for adults too. One of the things that I've had a lot of success with is we have video glasses. They're kind of like some virtual reality glasses that plug into a DVD player, and you can watch a movie while we're doing whatever dental work you need.
Oh, wow. That is cool.
And it's a great distraction. If you add nitrous oxide to that, I refer to it as watching a movie with a cocktail.
Oh, my gosh. Okay. So does the book find its way to the waiting rooms of all dental offices? I would imagine this is a perfect book to be reading while you're waiting for the dentist.
Yeah. I'm trying to get it out there. It helps people realize that they're not the only ones that have this, because most people with dental phobia and a lot of other fears throughout life feel that, this is something that's only happening to me. Everybody else out there doesn't experience this. And there's a million different statistics out there on how big a segment of the population has this. In my opinion, it's way over 50%. So this really helps people with that, and it also helps other dentists develop and work with patients that have fear, because at most dental schools, this is glossed over in about a 5-minute lecture, and that's the sum total of your training as you leave dental school.
Oh, so this is as much for dentists as it is for patients.
It's for both.
Sometimes the numbing procedure can put fear in people. How do you alleviate that kind of fear?
One of the things that we've had great success with is nitrous oxide laughing gas. So much so that I stopped charging my patients for it, and about 80 to 90% of my patients use it. So we start the nitrous oxide laughing gas, get it to a comfortable level, then I spray a pre-numb, we call it a topical. It kind of tastes like cherry cough medicine. It's kind of a potent taste, and it works virtually instantly. Then I tell them what to expect, and then I can numb them up, and it's a much more comfortable, positive process for them.
Does laughing gas make you laugh?
In my entire career, I bet I've had about 5 people that have actually laughed. It's kind of a misnomer.
Oh, okay. I would think laughing would be in the way or get in the way when you're doing somebody's mouth.
But if you're laughing during a dental procedure, say a root canal, things are going really well.
How can you work? How can you work when they're laughing?
Do you ever take videos of the procedures itself to help new dentists that are still in school?
No, I haven't done that yet. The HIPAA privacy rules are kind of funny with that stuff. We have to get everybody to sign off, and most of my patients would not go for that, so I haven't done that yet.
So give us an overview. What kind of things do we learn, ways to overcome the fear of a dentist?
So it's the most important thing is finding a good dentist who is going to work with you. A good dentist is going to help reduce barriers for entry. They're going to make it easy for you to come in right away. Because for most people, when they work up the courage to make that phone call and make the appointment, they don't want to come in 2 weeks. They want to come in today or tomorrow. So getting you in right away while you've got the courage is really important. The people that you interact with, both in the office and on the phone, should be pleasant, warm, inviting, welcoming. If they're short and rude with you, move on. The dentist and the staff should make eye contact with you when they're talking to you. They shouldn't be looking down at their shoes or up at the ceiling. They should be making eye contact with you and let you know that you're the most important person in the room, and you care about what's going on and their story, so you can get kind of the background on their situation and understand why they have the fears and figure out the best way to help them work through them to get the work done that they need.
Does modern technology give you a tool to show us, the patient, what our mouth will look like when you're doing cosmetic dental procedures, I should say? Because that would alleviate fear. If I said, oh my gosh, I don't mind a little pain if I'm going to look like that, if it's going to be a nice looking mouth.
Yeah, there's a bunch of different imaging softwares. We take pictures with our intraoral camera, and then we run it through this little software program, and I can make teeth look, I could make them look purple with pink polka dots if that's what you wanted, to show you how we can get you to where you want to be. Yeah, it's a wonderful tool to show people.
And also, too, people have this, everything costs money, and sometimes it's hard to get dental insurance. How do you advise dentists to work with people that need to have dental work done, but they really can't afford a whole lot?
We did a couple things. We developed an in-office discount program that gives people a 15% discount off of all dental work, which is similar to what some dental insurances would provide. But it doesn't have any of the headaches and the restrictions and anything that dental insurance has. We also work with some outside financing companies that, if you're approved for this, I actually pay the interest for you for the 12-month period. Mm-hmm. And then twice a year we do free dental days. One we just did back on Valentine's Day. It's called Dentistry from the Heart, where it's a free filling or free extraction for everybody, first come, first serve. And then around the 4th of July, we do a free dental day for vets.
Oh, wonderful.
You're
marvelous.
Outstanding. You are a leader in your career for sure, in your field, I should say. Dr. Scott Shamblott, thank you for what you do and for taking time to talk to us and for writing the book. I think it's going to help a lot of people. I found it on Amazon. You're getting good reviews. I see 5 stars across the board. Do you have a website you want to share with us?
FixMyTeeth.us.
There you go. Fix My Teeth. I love that.
.us.
All right.
Nice.
We're going to send a lot of people to your website. Thank you, Doctor. Thank you for being on there with us today.
Thank you.
We'll be right back.
If you find an animal or a bird that needs help, call Animus Foundation at 352-843-6379. They will come and get the animal if you can't take it to them. High school students and those with court-ordered community service can earn